More shelter beds are appreciated, but are not the solution, says Colleen Christopherson Cote with the Saskatoon Poverty Reduction Partnership.
In looking at all of the details, that this plan probably will create and perpetuate cycles of homelessness and poverty in the city.
And for mental health and addictions,
The government has pledged $90 million. $40 million of that will go toward fighting homelessness over the next 2 years. The plan includes creating 155 new supportive housing units in Regina and Saskatoon, and more emergency shelter spaces.
$14.1 million investment will create up to 120 new permanent emergency shelter spaces in Regina, Saskatoon, Prince Albert, Moose Jaw, and other communities based on need. This means there will be approximately 500 permanent emergency shelter spaces available this winter across Saskatchewan.
the 30 beds.
Those who help people on the streets say this plan won't meet demand and won't address root causes of poverty and addiction.
I can guarantee you in no uncertain terms that there are at least 500 people experiencing chronic homelessness in the city of Saskatoon alone. In fact, I would be so bold to estimate if you were to incorporate everybody that's experiencing homelessness in one way or another in this city, just in the city of Saskatoon, we would be in the numbers of thousands of people experiencing homelessness.
It's not going to get people off the street in the way that it's supposed to be and housed in the way that they should be. And then going forward, there's nothing to suggest that things are going to be changing. So the systems that are creating poverty are still in place.
As for addictions and mental health issues, the government will spend nearly $50 million to create 500 new treatment spaces and a central intake system.
The new action plan will have 3 priorities: building capacity so that we can help more people recover and live healthy lives, creating a central intake system, and transitioning to a recovery-oriented system of care for addictions treatment.
But the plan doesn't include several things community agencies have been lobbying for. There is no operational funding for supervised consumption sites, and there are no changes to the income assistance program. Pratish Dayal, CBC News, Saskatoon.